Hello, Facebook friends. It's Carla, your online doctor, with today's Live in 5. Today is Friday, February 21st. It is 5:06 p.m. I apologize for being a little late. Thank you, South Florida traffic. And my last appointment ran a little bit over as well. So here we are. Hope you guys are having a wonderful Friday and are looking forward to the weekend. It's going to get a little bit cool here in Florida. By cool, I mean about 67, 68. I know people up north are saying, are you kidding me? But what can I tell you? It's a little yuck outside right now. All right, so we've been talking about thyroid function. And yesterday I gave you a list of the medical options offered for the most part by the traditional Western medicine doctors. So what an endocrinologist might offer you if you have a thyroid condition. Hello, Brina. So let's talk about natural treatment options for thyroid disease. Clearly, if your thyroid is at low function or hypothyroid versus overfunction, hyperthyroid, some options may not apply and might require you to do a little more research to find the root cause and treat that cause specifically. Okay, so it's not going to be a one size fits all, as we're talking even yesterday, the same thing. Okay. Most importantly, you want to make sure you consult your medical professional. Understand that if you use a traditional endocrinologist, they're probably going to look at you and say, natural options don't work. If you want to go the natural option route, you need to find a integrative physician, a functional medicine, a holistic doctor, somebody who's going to work with you and help you do this in a more natural way. Okay, so let's talk about hypothyroidism. The number one treatment for hypothyroidism recommended is iodine supplementation. Now, daily requirements are 150 micrograms per day. Food sources are often best, but either way, food or supplement, too much can be problematic. So this is an area where you need to stay on top of your numbers. Even though we're going naturally, you still need a measure of what's good and what's bad. So if you're taking iodine supplementation for hypothyroid, you need to either follow, well, I shouldn't say either, you need to follow your iodine levels and your thyroid levels to make sure that you are keeping everything in a good range. Number 2 would be vitamin B supplementation. Now, B vitamins have many interactions with thyroid function and overall hormone regulation. So taking a B complex that has all the B vitamins is really important, but you may need additional B12, specifically if you test low for B12. Okay, so as you hear me say testing, that means you need to have somebody who can order blood tests for you so that you can check these things. So you need to check your vitamin B12 level. Number 3 is selenium. Now, selenium supports efficient thyroid synthesis and metabolism. It may also decrease thyroid antibodies. So against the enzyme, specifically the enzyme thyroid peroxidase, the enzyme that plays an important role in thyroid hormone synthesis. The recommended daily allowance of selenium is 100 to 200 micrograms. So this is something, again, that you could add into your routine to see if it improves your thyroid function tests. Number 4 is zinc. Hello, Cecilia. Zinc plays a role in the conversion of T4 to T3. Okay, remember, T3 is the active form of the thyroid hormone. So you want T4 converting to T3 so that that hormone that needs to be active in your body is in a higher percentage, especially if you're running hypothyroid, if you're running low. And remember, zinc is also really good for fighting viruses. We're going to talk a little bit more about that next week. But the recommended daily allowance for zinc is 8 to 11 milligrams for adults. Okay, so this is one that you can just check if you take a multivitamin. You can just check both selenium and zinc, see if they're in there, and then you would be covered on that. Okay, number 5 is tyrosine. Tyrosine is an amino acid involved in thyroid hormone production and conversion, right? Obtained mostly from protein in your diet, but you can also supplement in addition. Okay, so this is not something that you have to really worry about unless you eat a very protein restricted diet. If you are a vegan, you really need to make sure you are getting enough of this in your diet because you're not eating any meat sources of protein. So you really have to make sure that your nuts and your beans and stuff have enough of this in there for you. Hello, Teresa. So, yeah, zinc is good. I agree. Okay, number 6 is vitamin D. You've heard me talk about vitamin D a gazillion times. Supplementation was shown to improve TSH levels on subjects with hypothyroidism, as well as thyroid antibodies in people with autoimmune thyroiditis. Okay, so this is really, really important, guys. I can't stress it enough. You need to be pushing your vitamin D levels up. It is an anti-cancer, anti-autoimmune, like all the bad stuff. Vitamin D is going to help everything, seriously. And the chance, even though it's a fat-soluble vitamin, the chance of getting toxicity from it is so low. Most of the experts that I follow say they've never seen a case of it. So even though the recommended daily allowance is usually 1,000, maybe 2,000 international units, I would push it much higher than that. I would encourage you to obviously follow your 25 hydroxy vitamin D levels and try and get them upwards or around 80. Okay, so if that means taking 5,000 international units a day, 10,000 for a little while, whatever it is, push your vitamin D level up. Your body will thank you. Okay, if you are hyperthyroid, so far we talked about hypo. If you are hyperthyroid, number 1, reduce sugar and caffeine. Okay, they worsen your symptoms. If you are already agitated, tachycardic, sweaty, running in overdrive, the last thing your body needs is sugar and caffeine. So you need to just cut that stuff out. You should probably do that anyway, especially processed sugar. Number 2, selenium. Selenium helps with hyperthyroid as well as hypo. So that is a good one for you to take as well. But here with hyperthyroid, you also want to look at magnesium. It reduces anxiety, it can improve sleep, it decreases menstrual cramps, just as an aside. It relieves constipation, relieves muscle cramps. But the best option for you guys when it comes to magnesium is either Epsom salt baths. And please, when you get your Epsom salt, make sure that they are unscented. Do not get the lavender or the lemon or the eucalyptus. All you're doing at that point is adding fragrance, which is synthetic chemicals that are going to make you worse. So if you want fragrance, I can get you the best essential oils to add to your bath. Do not get the scented ones, okay? And the other type of magnesium, which is really good, is magnesium oil spray. We got ours at Whole Foods. It works amazing, okay? Just saying. Number 4 for hyperthyroid is diet restrictions. You really need to be looking at staying gluten-free. Refined carbohydrates like bread, pasta, and cereal need to be cut out. Refined sugar, heavily processed foods, fast foods, inflammatory fats, alcohol, all of these things are inflammatory, especially to your thyroid. So even if you're not hyperthyroid, but you have autoimmune related thyroid condition, you need to get rid of all of this stuff. Hello, Kelly. Hello, Rita. Okay, so you really need to stick to an anti-inflammatory diet if you have specifically, like I said, a thyroid condition. Find foods that agree with you. And by that, I mean not like agree with your stomach, agree with your thyroid. Okay. Number 5 on the list here is low dose naltrexone. LDN. Now, that is not a natural option. It is a prescription. However, it is used as an off-label to treat autoimmune conditions, including Hashimoto's. So if you have tried everything else and nothing seems to work, that is something that you may want to consider. Again, you need to be seeing a doctor that's going to work with you and is willing to try that. Number 6, anti-inflammatory supplements. That includes fish oils, turmeric, glutathione, and again, vitamin D3. Okay, so the list goes on. And I'll put number 7, which I didn't even write down, but I've been reading a lot about this. And one of the things they're actually recommending now for thyroid conditions is CBD. Okay, CBD is anti-inflammatory, so it is going to work everywhere your body is having inflammation. So again, you need high quality CBD. You do not want to be buying gummies at the drugstore. Okay, so if you're looking for a high quality CBD product, send me a message. I have helped so many people at this point get rid of pain and all kinds of issues using the same CBD that I use. It is amazing. So that is what I have for you in terms of natural options, okay? It is not all-inclusive. It does require you, again, to do your homework and know your root cause, know the cause of your thyroid condition. But you need a doctor that's going to work with you. And if your traditional MD or DO is not willing to work with you and use alternative options, find yourself another doctor. Just saying, there are too many doctors out there that are starting to understand that we as a society want these options and they want somebody that will work with them. You are hiring them. They work for you. So find yourself another doctor and get what you want, obviously making sure that they know more than you do as far as traditional medicine. Find somebody in the functional medicine, integrative world, holistic world that knows about thyroid and can help you. So that's what I got for you. I hope you guys had an awesome week. I hope your weekend is full of friends and family and all kinds of fun things. And I will see you again on Monday for another Live in 5.